Number 2. Better prediction of suicide risk.
Suicide is a vexing problem, particularly in the U.S. It ranks as the 10th leading cause of death. Even more alarming, suicide is the second leading cause of death among young people. In 2016, there were 45,000 suicide-related deaths in the U.S., twice the number due to homicide. For doctors, figuring out which patients are at risk of self-harm remains a major challenge. Clinical methods for flagging suicidal patients remain extremely inaccurate. And while conditions like depression and anxiety are often precursors to suicide, more than half of the individuals who attempt suicide have no prior history of mental illness. Now, researchers are leveraging AI-based approaches to help counteract this worrying trend. For example, 2 Boston-based teams have mined the information in patients' electronic health records to help identify which patients are at risk of suicide. In one study, it was possible to predict nearly half of all suicides and suicidal behaviors with remarkable specificity, and importantly, well in advance of patients' self-harm. As encouraging as these efforts are, they are only first steps. The studies must be replicated using additional patient datasets, especially those from other healthcare systems, in order to determine the tool's broader applicability. Meanwhile, various teams across the country are focusing their attention on perhaps the most tragic problem of all, teen suicide. Instead of analyzing electronic health records, researchers are examining social media content with the goal of detecting early warning signs of suicide. For many people, particularly youth, their interactions with social media are much more frequent and sustained than their interactions with the healthcare system, making this area ripe for investigation. Yet these efforts come with some significant ethical and privacy concerns, issues that must be carefully weighed as the medical establishment and society at large grapple with how to prevent suicide. If you are thinking about suicide, there are organizations you can turn to now for help. Call the National Suicide Prevention Lifeline at 1-800-273-8255, TALK, or visit speakingofsuicide.com/resources for a list of additional resources.